Dr. Sara Madad, I'd like to begin with you. Now, when we're talking about reopening of the economy and various sectors of the economy, and then reopening schools, how do the health concerns differ and vary in those two different sectors?
Well, I think first it's prioritization, right? So the education of our children is extremely important for many different reasons, not just because of the academics, but also because of the social environment and everything else that it brings along with it. And so that really first needs to be prioritized. And in order to do so, you need to make sure that if you are trying to make sure your economy is booming and you're going to have bars and restaurants and mass gatherings and theaters open, well, what that's going to do is that's going to increase the infection of COVID-19 in your community. And we cannot have that if we want to open schools, because one of the biggest baselines that you first need to start off with before even thinking of opening schools back up is you need to have the virus in the community at very low levels of transmission. And so to put actually a number to that, public health experts are saying at least less than 5% in terms of just overall cases in the community, and even the percent positive of cases. And so that's really first needs to be prioritized. Then we can have some sort of a discussion of how to open up schools safely by having various controls and mechanisms in place. But really, we need to make sure that economy is very important. I definitely don't want to argue that economy and the livelihood of people is extremely important. We also need to make sure that there's active steps we can take to mitigate having a lot of infection spreading in the community by closing down some of these indoor gatherings and making sure that we're prioritizing schools